Hello everyone. Today we'll try to use breath to engage our core. So we just keep our arms besides on our intercostals and we breathe in as if we are trying to expand our diaphragm in a way that we feel the expansion in all directions, majorly on the side and back rib because that is the difficult area to access. But we are moving in all directions, diagonal, how much ever possible, expanding the diaphragm. So inhale and then exhale. Inhale and exhale. Inhale and exhale. So inhalation we understood expanding the lungs in all directions. Exhalation you can as if you're blowing a candle from your mouth, and don't just pull the lower abdomen or the mid portion or the top portion. Let the whole thing sink equally through blowing the candle. And the ribs should not go down again when you start exhaling. So try, inhale and then exhaling the whole thing. Lip stays the same, it doesn't go in and down on exhalation. In fact, the abdomen slightly moves in and it moves upward as you exhale. So inhalation is all directions. Exhalation is inwards and upwards. Inhale and exhale. So breathing like this whenever you do any core based exercise or any exercise will help you to keep your core engaged while doing the exercise. So we can try the same breathing lying down. Keep the block under the head. Inhale into the lungs, keep your hands on the side lungs and try to breathe in a way where you are feeling the diaphragm expanding downwards more so that the back of the lung and side of the lung, the whole lung expands properly. Inhale. And then exhale in the same movement, blow the candle and invert and upward movement. Inhale and exhale. Inhale and exhale. See the whole patch is sinking, not one line. So ensure you should not feel a pull in one line in one specific area like this. The whole thing should sink. So this is the breathing pattern, and you can use a pillow or a block under the head when you're trying that. Another way of doing it, you can keep the block underneath the hips and breathe the same way. That will help you to bring the upward movement easily. So you same way breathe in and breathe out like this. When the block is under the hips, you can do that upward action exhalation easily. And you can keep the block underneath the back and rest your head a little higher than the block. You can keep two pillows and then rest your upper back on the block and head on the pillow. Your head should be slightly higher. Try and use two pillows instead of one. And you can breathe in the same way, lungs expanding in all directions. And exhaling, abdomen moves in and up. This will make the inhalation easier, and when you keep the block underneath the hips, it will make the exhalation easier. So you can try breathing in these two positions, which will make you understand exactly how the inhalation and exhalation should be. This is the first thing. After that, you need to understand how to rest your scapulas on the floor and pelvic on the floor. I'm keeping the arms aside so that you can see, but you have to keep the arms beside the body itself. So, see how I'm arching my sternum to rest my back. You can use a towel instead of pillow, that would be more comfortable when you exercise. But when you're doing other exercises, a pillow is also good enough when you're just breathing and not exercising. So the difference? Sternum is down, everything is flat. I use my rhomboid muscle between the scapular muscles to lift my sternum. You see that elevation? Lift it towards the face, not towards the spine, so that the back muscles are not tense. The moment I do that, see the shoulders. It's very closer to the floor, and now both the scapulas are equally resting. This is important. And then your pelvic will naturally rest, because there will be small arch in the back which will allow the back and pelvic to rest properly. So try maintaining this while breathing. It will be easier to breathe if you are maintaining the sternum up and pelvic resting. Just check. Your breath will directly go into the lungs when you are into that position. When you are exhaling, you can get better control on the abdomen. So maintaining this, you can just drag the leg in. Inhale, and then exhaling, drag the leg. Same way, arch, rest your pelvic, inhale, then exhaling, drag your leg. Maintain the integrity of abdomen and back while sliding the leg out. Your pelvic should not just fall towards the leg. And then inhale short there, then exhaling, bring it back. You can use this two-way breath, or you can just inhale and slide, and exhale and bring it back. Important is to maintain that scaps lifting the sternum and pelvic while sliding from the front of the hip joint. That inhale, that exhale which we did the initial breathing, keeping that while moving this leg and not shaking the pelvic is the challenge. Try doing this 2 sets, 3 sets, 10 from each leg. And then you just, without shaking the pelvic, maintaining the back arch and pelvic resting, you inhale, lift your leg, exhale and bring it down. You will see you will not feel much controlled over here. But you need to try and not shake too much and keep the abdomen in and maintain the breath when you do that. Inhale, lift, exhale and bring it down. That would be the single breath. Other ways, you inhale small, exhale and lift, inhale small, exhale and bring it down. Whichever way you feel more control, you can use that way. So first for sliding, second is lifting the leg like this, third is alternating the leg like that only. Right? Inhale, lift, exhale down. Inhale, lift, exhale down. When you do same side and when you alternate, the challenge is different, so you do that. And then you can keep the legs up only and then extend the leg like this. And then bring it back. So 3 exercises we did: leg slides, tabletop, leg extension, and then you can keep the leg little higher and just slide it out. If higher is too difficult for now, you can begin with sliding the leg to the side and bring it back. So difficulty is not making the leg movement. Difficulty is to maintain the torso and pelvic floor connected, and upper back and pelvic should stay resting the way it is instead of it sinking down. So maintain that integrity into this leg movements. Slide, tabletop, alternate tabletop, leg extension, and then moving the leg out, keeping the leg slightly in the air. So repeatedly do this exercise until you feel a bit more control over here. Apart from this, when you feel these things are pretty much like little bit more control rather than not feeling anything, then you can start doing this also, keeping both the legs at tabletop, bring the knees a little more closer to the chest, and try to breathe the same way. Inhale into the lungs, exhale into the whole core, moving it inwards and outward. Breathe like this and slide. As you get better, bring the legs at tabletop and breathe, and then try to do the toe taps, this time keeping both legs up. And then the same way you can do the leg extension also as your core gets medium strong. This will be the two exercises, and then third one would be you can move the legs side to side. So maintaining your head and upper back fixed, you just move your leg side and bring it back to the center, using the length from the obliques from the levels. Your head stays fixed, your scapes, upper back stays fixed, and only use your oblique to move the leg. Don't try to clench or hold your lower abdomen. And then relax. So apart from this, bridge is another thing which you would like to do for the core, to bring that controlling combination between the pelvic, legs and torso. Bridge has usually, just exhaling, sinking the belly, lifting the tailbone, and articulating the spine up, and then articulating it back down. So doing this, and also what you can do is keeping the legs on the chair, legs up, and then doing the bridge. So your hamstring starts getting used. Try doing this much and let me know how you feel.